Hello and welcome to GatherVerse Women's Health Summit 2025. What a superb fireside chat we just had with Christopher and the lovely doctor. But on this amazing panel, I have an incredible lineup here today where we're going to be speaking about women leading healthcare innovations for women, why that matters. If I could ask everybody to just mute their microphones so we don't have any sort of feedback or background noise, so that we can allow each other to speak. And what we'll do is we'll go around and have a quick 30-second introduction from each individual person. And also, I would like to hear as well why each of you are here today as well. So we'll start with Teresa, then we'll go to Janine, Mariana, and then Sorsha.
Hi, everyone. I'm the founder of Make a Difference Now, and we have a commitment to providing youth and women with access to quality education. And through that access to education, we're really focused on the underserved in areas like Tanzania, Africa, Guatemala. We're really global, but reaching out to the villages and utilizing AI to help reach women who normally wouldn't get the chance to learn about healthcare.
And it's great to have you with us today, Teresa. And also quickly, before you mute your microphone, just quickly also like why you're here, just in general, just to add to your introduction.
I'm here because I want to talk about the women who are normally not being represented. There's so many women in villages and rural areas that we don't talk about. We talk about the cities. We talk about, Silicon Valley and what's happening there. But there is a unique approach that we can take with AI to also address women, and they make up a large percentage of the women in the world, in the rural areas, in the villages that we normally don't talk about.
Well, thank you for joining us, Teresa, and thank you for sharing that. And Janine, same for you, 30-second introduction, and obviously why you're here as well, please.
Hi, my name's Janine Van Someren, and I'm the founder of the Wellbeing Advantage. And I help bring insights from 15 years experience in high performance sport. And my current work is in corporate wellbeing programs. And I help people using wearable technology. And the reason I'm here today is because, unlike Teresa, I'm sort of at the other end of the spectrum in terms of my clients. They are corporate C-suite executives, but I'm very aware that it's a male-dominated space. And the female voice, when it does get heard, quite often leads to really positive well-being initiatives. But the problem is it's just not heard enough at the moment.
Thank you for joining us, Janine, and couldn't agree more. And Mariana, please, 30-second introduction from yourself and obviously why you're here.
Thank you for this space. I hope everybody can hear me clearly. Just nod your head. I'm enjoying my metro backdrop today. So just a little bit of a background. I was a chemist in my past life. I was not happy with corporate healthcare. Decided to leave in COVID after, my extensive career there in the laboratory emergency. So, I mean, you can imagine, right? I'm painting this picture where it's just like high stress, high level of unhappiness, truly, to be completely clear here. And I decided to make a change and take a step forward and establish something of my own in order to inspire other people, not just women, but men and women, to sort of take charge of their health and search for something that is more pleasurable it's more enjoyable, and that's still within the health sphere. So I founded Ascend Wellness Portal, and that lasted for about 5 years, and it's still in its startup phase. Then I went on to invest to the investment world, to the finance world, in order to fuse these two things together. And now I run Investors with Legacy, fusing health and wealth all across the board. And that's what's truly been magical for me. Health and wealth is where the two things combine and meet right in the middle. And I believe I found the secret formula.
I love it, Mariana. Thank you for joining us as well. And lovely outside there. Like, it's a lovely...
It's the weather. It's Texas for y'all.
Yeah, it looks lovely. Thank you for joining us. And Sorsha, please quickly introduce yourself. And and why you're here as well. And by the way, hello, little one.
Oh, hello. Let's please try and keep her quiet. She's sucking on a strawberry right now.
Okay. Right.
Amazing to be on this panel and to hear another Irish accent for the first time as well. I think I could speak for everybody's backgrounds there. I'm in a rural setting at the moment. I've worked in corporations. I'm working on health and wealth at the moment as well, which is phenomenal. So we must catch up after this. My background is corporate and treasury finance, but I've been working in the startup space nearly 8 years. I was listening to the last panel actually a lot about AI, and emerging technology has been frightening people as much as it's been inspiring people since the beginning of time. So just a shout out to say, please focus on the positives and just be aware of the negatives to anybody who's listening. My focus for healthcare really, I suppose, it started with a mental health and a burnout perspective, which led to health complications, which led to infertility. I have 2 beautiful daughters, but they took 8 pregnancies to bring into this world. And this was the reason that Christopher invited me to come and speak at this summit today. So I've been through the healthcare system, the woman's voice of maternity not really being represented, and doctors not understanding the questions to ask or the way to ask them. And I was actually asked on one occasion, was I sure that I had miscarried? You know, I was also prescribed prescription drugs that I felt I didn't need, and I didn't in the end. So there's so much that I can bring to it. And now having 2 daughters of my own, this is more of a responsibility, because we may be in the era of action to make sure that this doesn't happen in the future for our children and our children's children.
Honestly, thank you so much for joining us, Sorcha, and it's just a pleasure having with us today. And last but not least as well, hello Aurelia, good to see you again. A quick 30-second introduction from yourself and also of why you're here today, please.
A pleasure, Russell, and to all these wonderful women here. Actually, healthcare is a topic that affects all of us, right? Like women and men. And why I'm here is I am connected with innovation. So as a person who is leading a big network of innovation professionals and really helping companies innovate basically around healthcare, and not only that's the angle that I'm trying to cover, but also because one of my the sensitive issues that I really care is women in general, gender equity basically, and women on innovation. So I created a support group for women on innovation, how we can include more women basically on innovation area, which includes also healthcare, and how we can advocate more for being in the decision making, being in the innovation teams, actually designing for women issues. So definitely that's a great panel, because certainly any of you who is basically loves to be part of it, more than welcome. Is a volunteering initiative I'm taking, and that's why I believe I'm invited here.
Well, thank you for joining us, Aurelia. And obviously, last but not least, before I get into my introduction quickly as well, Lynn was originally supposed to be moderating this roundtable. She's currently not very well at the moment, so that's why she's not moderating today or this specific panel. So that's why I'm here instead, covering that lovely slot. So just thought I'd quickly add that in. And quick introduction from myself. So my name is Russell Bundy. I'm the Director of Partnerships at GatherVerse, and I'm also the founder of Just Verify as well, where we're focused on basically creating a verifiable and trustworthy future in building the trusted digital world and ensuring authenticity, accountability, and safety for all in this new AI world that we're going into. So that's pretty much it from me, and I want to get straight into these questions because there's so much to discuss and so much to get into. So the first question is, what unique challenges do women face in healthcare innovation, and how do you work through them? So I'm going to start with Janine, and then we'll also go to Aurelia after. So Janine, over to you.
Hi, thanks, Russell. Yeah, one of the main challenges that women face in healthcare innovation is their underrepresentation in when the technology has been designed. So by the time the female is using the technology, quite often it hasn't actually been developed for a woman's body. And therefore the results they get and the data that they're using isn't exactly aligned to what their needs are. In the technology that I use, it's something called First Beat Technologies. It's a wearable device, a chest wearable, an ECG, which allows for measurement of heart rate variability. And it's specifically chosen because it tracks clients' wear over as long as a 3-month period, and it really responds to changes in the individual, which means that the data allows for that accuracy with regards to, in particularly, those hormonal changes that occur. While if you're looking at data set that might be like a one-off device with my wearable tech on my wrist, it lacks meaning outside of the context of a 28-day cycle. And the hormonal fluctuations are really needing to be taken into account when we look at the challenge of healthcare innovation.
Yeah, I mean, it's funny that you bring that up, because the last roundtable were literally saying the exact same things, and how there's a lack of data when it comes to training AI models in terms of the women's aspect, and how it can be used accurately and positively towards women's health. So I'm glad that you brought that point up, Janine, because that was previously shared in the previous panel. So I'm glad this is also crossing over to this panel, and it's not just a one panel thing. So that's fantastic. And Aurelia, what are your thoughts on this as well, in particular?
I'll continue in the same basically sort of direction that Janine was pointing out. Let me give you a few data, right? Because that helps us clarify the situation. So there is a 10.8%, I think, in terms of the funding from the National Institute of Research that goes to women health research. And there is just 2%, okay?
Oh my God.
Pregnancy, childbirth, and basically female reproductive health. And I think one of the women here in the panel mentioned that. I hope we'll hear more on the examples, but that's crazy. Why? Because women are bringing life to this planet, and there is like 2% going into the medical research. So this is the data that kind of should sort of speak for itself. And then there is lots of diseases, heart diseases, basically, which is one of the main causes of death for women that is under research. Even the symptoms are not known. What symptoms do women? For example, men have usually chest pain, women have back pain or have nausea and all this, so are not known. Even like CPR, basically training mannequins basically are used on males' bodies, so kind of are not used on females. So it's kind of reluctancy when you want to do a CPR because you don't know quite clearly the anatomy of a woman. And then not to talk about the autoimmune basically diseases, which kind of is 80% of women have that, which is under-researched or misdiagnosed. And same thing happens in pain management or doses. And I think, again, it was kind of mentioned a little bit. But I'm talking about myself. For example, endometriosis is like a disease that I learned I might have that only by reading, because I was going to my gynecologist and telling her, hey, I have severe pain while I'm in my period. And she would say, it's normal. That was the only, it's normal. That was the only basically answer. And I took basically pills in order to sort of feel better. And then I discovered by reading a lot. So there is so many like this. I'm just at the surface level. So many diseases that are because are not are under researched, that when women go to the doctor, right, or to the specialist, they get this answer that, oh, it's normal, or probably is this, but they are not getting the right answer.
Oh my God, that's crazy. Saoirse, actually, I really want to bring you into this conversation. You heard the crazy stats and everything there. Like, please, share with us like your side of things and what your thoughts are on all this as well.
Well, I think that experience was very much mine as the patient, and then coming out of it and feeling I have to do something about this, and I think that's the voice of every woman who's moved into healthcare after they've gone through a health experience, that they realize, where is my voice? Where is my face? Where is my data in this? A data with respect and translated and interpreted to be relevant, and not just for everybody here at this table, but every ethnicity has a completely different context as well. It's environmental, and then also there's healing physical, there's healing mental, and then there's healing emotional, and they are all completely different. I had an experience with my daughter just 2 weeks ago, my 3.5-year-old, where she had a freak accident having so much fun with her friend that she fell and had to have emergency surgery in the inside of her mouth. And over a 3-day period, I watched in action the utter horror that I felt emotionally and psychology of when I was going through my situation, bringing my babies into the world, but lack of agency, boundaries broken, and not being able to vocalize or articulate the problem. The psychological implications that could have had further down the line had I not been able to nip it in the bud and let all of our family and friends know, look, this has happened. She's going to be expressing this in different ways, and for her school to rehabilitate her. This could manifest years later as a problem in stress, anxiety. So we're not taking that into consideration at the moment. And it's something that I feel incredibly passionate about. First and foremost, as somebody, I have a voice, I have a network, I have the will behind me to do something about it. I'm outside my lane. I'm very comfortable being outside my lane, and I'm very much learning and standing on the shoulders of giants in the venture capital world, who are like Naseem Sarani, who I was speaking to online earlier, on LinkedIn, Swizzle Ventures, Jessica Kamada, who's funding startups, and speaking about the menopause as well, I'd love to mention Victoria Finlay from the Menopal, who's doing incredible work at the moment. So look, we're at a time where emerging technology is making this move fast. Women have economic power. We've got 60% of the world's wealth, according to a recent data source I found earlier in 2025. And in the next 4 years now, or 5 years to 2030, there'll be a huge wealth generation transfer, and health is wealth. So we have to make sure that the women that are holding this wealth are healthy so that we can use and deploy it.
Wow. There was a lot to unpack there, but very, like, I think it's amazing in what you're doing and what you're expressing, and so also you're just like, I don't know how to explain it. Amazing, I guess. In one word, amazing. So it's a pleasure having you with us, Saoirse. And yeah, so we do have some other questions which I would like to go through on the panel, and Mariana and Teresa will be coming over to you both, which is, how does gender impact the design, development, and implementation of healthcare technology? We did briefly obviously discuss this with Janine, but Mariana, please, what are your thoughts on this?
Yes, so I would imagine, right, you walk down a hallway of a hospital, and the first thing you do notice, I don't have the exact data off the top of my head, but the majority of nurses tending to the patients are women. Or even if you walk into the cafeteria, the people serving you your food are women. Some of the pediatrician doctors and whatnot, you go to sometimes male doctors, but now it's becoming that the majority of PAs and furthermore, lab technicians as well, or even phlebotomists, they're mostly women. So to me, in my head, it's just, I still don't understand how we're taking a back seat to driving this force forward when it comes to innovating within the healthcare field and allowing, our priorities to also sort of take front end here, because we are just being served to the service of these high profits and high yields and fast turnaround times and whatnot. However, we're forgetting that human factor, that we need to take care of ourselves first as providers, as healthcare providers, in order to take care of others. And that's something very emblematic and that I've learned along the way. If I'm not well, if I'm not feeling nurtured, if I'm not feeling, stable, if my hours are just too much, and the demand is not there, and things are not being staffed properly, and so it's very many factors. So taking it just maybe a little bit beyond just technology itself, it's the systems that are in place, right? That first we might need to look at, and then down the line, the technology will evolve accordingly, following those systems. So something at the very core needs to change, and you do start to see it more. More often, they start to come out with like meditation programs, or allowing moms who are feeding to sort of have those special schedules. But even then, I mean, within the United States in the healthcare field, there's still a lot of improvement that needs to be made. I would think that everybody else on this panel agrees, and which is why we're here today to discuss these
Absolutely.
changes that do need to take place, and quite soon if possible.
Absolutely, and well, self-care is obviously fundamental. I completely agree with that, and kind of bring it back to the point when you're saying about systems. It could be like if a man, so to speak, right, create the system, but then forgets about the women's health side of things within that system, then that could cause like the bias, and then have a lot of repercussions from that, right? So to your point, and kind of bring back to the question, which is, how does gender impact the design, development, and implementation of healthcare technology? To your point is, if a male doesn't understand women's health, and then they create the system and then forgets the women's health side of things, then that could be causing the issues and the repercussions from that. So, Mariana, do you want to just jump in quickly on that?
Correct.
Yeah.
You rephrased it beautifully, by the way. So thank you for that. Yes, it does go beyond numbers. Like, we are not just numbers on a little timesheet where our higher superiors are delving into daily. Like, there needs to be this understanding that women are nurturers by nature, and this being a women's health summit is just, I would encourage every single woman within the healthcare field to speak up about their needs and not be afraid of retaliation or any sort of thing like that with their supervisors. And in truth, there could be more done on our side, like us, the workers at the bottom, because the supervisors are just following orders from the higher ups, right? This is like this little tier that gets created, and we take up the higher. If you see it as a triangle at the bottom pyramid, we take up the higher chunk. Like, we should be the ones sort of not being afraid to speak upwards and to make sure that information gets to the top, and gather information, talk to your peers. It's like, how can we improve this? Like, what do you need? What do you need? What do you need? Okay, somebody write all this stuff down and make sure that the top is listening to what the bottom needs to say.
No, I agree. And Teresa, do you agree on everything that's been expressed so far in terms of how does gender impact like the design and development and implementation, if you will, of the healthcare technology?
So I was thinking about, Mariana, and what you were saying. We need to ask the questions. We need to check in and see what's going on with everybody. How are you feeling? Is this working for you? This is something we've been doing a lot. We are an international nonprofit that's providing quality education to disadvantaged youth and women. And with that in mind, one of the unique things that we've done lately is we have found, as students are graduating from orphanages that we've set up scholarships for, and they're going to college, they have many needs just to finish school. And one of those is just administration. They have challenges with to show up to their classes. I know it's very basic, but cramps, migraines, and they're having a hard time showing up to their classes. We also have an LMS, a learning management software system that we've set up, which has been amazing. The last 3 years, we've really been working hard on that, where we've been giving women access to how to set up a CV, cover letter, tell their unique story, and apply for jobs. And within that, we've seen, as we've been trying to open the doors to more and more women to come in so they can get jobs through our LMS and taking that program, they can't show up because of challenges with healthcare. So,
Mhm.
and challenges with taking care of their kids. You see Sorcha right now. I love that you brought your baby on. It is so real. This is life. We
Yeah.
have babies to take care of. Often that falls on the women. And we also want to nurture those children. So it's maybe natural too. I know as a mom, I often want to do that. With our LMS system, we check in as women are learning about how to get jobs, which is going to help later take care of their health because they need income. We have little breaks from AI that we bring into the LMS, which is really unique. You don't see that very often. Every 60 minutes, we're saying, take a break. And we're checking in, talking back to Mariana, we're checking in with them and asking questions. How are you doing? How are you feeling today? How's your mental health? How's your physical health? Why we're doing that with the LMS is these women are coming from rural areas. Many of them are coming from one bedroom homes with their kids in the room, their spouse in the room. And I, as a international CEO of this nonprofit, I do have more space to work on my healthcare, but even I find challenges just to even talk to a counselor. Your husband's around, your kids
Wow.
are around. How are you going to connect with them? So this is a really unique way we've been taking as they're on the computer, they're learning how to get jobs and how to support themselves. We're also popping in with AI and saying, how are you doing today? What's going on with you? Is there anything mentally that's challenging? We ask really important questions. We also bring in health breaks where we're having virtual, they're not always real individuals that come up. They're animations that come up sometimes to just stopping them working on resting, doing neck breaks, standing up, taking care of themselves, because sometimes it's the only time in their day that they get a break. So those are some of the unique challenges that we're paying attention to. And with that, last thing I want to mention is AI is so unique in the rural area. And I know it's kind of strange hearing from someone who's working in more rural areas and more disadvantaged populations, but we've been seeing that we can pull in AI. They may not have access to computers every day, but we can get them on WhatsApp. They have phones, and we're pulling in AI in that area to just talk with them. As Mariana was saying, check in with them, just see how they're doing, and taking that data back and seeing how we can help them more.
There's a very interesting use case in how you use AI to support in terms of the healthcare side of things and how it supports, which I think is very interesting, and I think it's fantastic and what you're doing and how you're using that in terms of the AI. And on the previous panel, they're saying about how AI, because the data can be sometimes trained in the wrong way and it can be inaccurate and stuff like that, that sometimes it can cause issues. So I guess a quick question for your side of things with your specific use case and how you're using AI, how do you make sure that it has the women's health side at the core focus, as in like how it's been trained and how it's used, if that makes sense?
Well, most of the time we're pulling data from them. So we're using AI to ask them specific questions on how they're doing. And then later on, we check the data that AI is providing to interact with them. So I feel like AI is so powerful, but you've always got to have the human check off, if you will. I've heard of many people giving data from AI and then later on fact checking it, and it's not correct. And I definitely want to encourage everybody to use both AI, but check off on it, because you never know if the data is completely correct. It is so helpful, but we still have to do those checks.
That is true. Yeah, absolutely. No, I agree with you so much on that, Teresa. And thank you for sharing that as well. And I want to move on to the next question, because with this question is very interesting, which is, what gaps still exist in women's healthcare that remain underfunded or or overlooked? So, Iridia and Janine, I want to bring you both on this, which is, what are your thoughts on this? We'll start with you, Janine, and then we'll go to video after.
Yeah, I think the area of women's health has never been overfunded, as you know, Russell.
Yeah, I got my words mixed up there. Don't quote me on that.
Exactly. No, we knew that was a mistake.
Yeah.
I think it's really clear from everything, you know, that we've been discussing, that areas like menopause, hormonal health, and maternal care remain underfunded and overlooked. In addressing these gaps, it obviously means increasing research funding and prioritizing women's health at a policy level. But more importantly, and I think in terms of definitely the role I can play, I'm not a policy maker, but I can definitely integrate these topics into more mainstream discussions, and whether that involves talking about it more through LinkedIn posts, raising awareness, through workshops. But for me, it's a really massive issue. The fact that when I'm working with either private clients or going into a corporate space, that the issue of menopause and how it's impacting women in their perimenopausal years is literally like a massive elephant in the room that people aren't discussing. It's leading to a huge number of women leaving work. It's, you know, the impact on women's performance is massive, and therefore, as an economic impact, it's huge. I unfortunately don't have the data in front of me, but if anyone does a quick Google search, the statistics are really frightening about the economic impact of menopause, specifically not being addressed in the workplace. Now, it can be addressed, and all it needs, again, I'm quite biased, I am talking about the corporate boardroom here, and again, Teresa, I'm sort of nodding towards you and saying like the different ends of where this health discussion is.
Yeah.
But if there isn't a woman in that space when a decision is made about what's going to happen or what is the program that we're putting together, then their topics are not going to be discussed. They're not going to be brought to the table. And therefore you have this real massive corporate problem. And at the moment, it's literally not been addressed. That gap is huge. So innovative healthcare that is inclusive, and that whether it's the technology is designed to make sure that every single person, regardless of their needs, is addressed in some way, shape, or form. But at the moment, it does tend to be that it is that underfunding, and it leads to a neglect of women's healthcare needs.
I just want to make sure it's not overfunding, right? It's underfunding.
Yes.
I'm only joking. But no, I want to bring Saoirse and Iridia into this, because Saoirse was like nodding her head. Iridia was just nodding her head so aggressively as well. So Iridia, what are your thoughts on what Janine just said? You know, do you agree with her? I mean, I'm pretty sure that you do, but just share your thoughts on this as well.
Yeah, I mean, all of us can only second each other or echo what we are saying, because these are not like our opinions only, are also backed up with data and everything. And whoever works with women, basically, or has women around, knows that this happens. I would add on what Janine said. I would add, beside menstrual, maternity, and all these things, I mentioned cardiovascular diseases, autoimmune diseases. I would mention also some type of cancers which are not even diagnosed in women, like cervical cancer or the polycystic ovary syndrome, which is big, and more than 70% of women go undiagnosed from this issue.
Wow.
That's a big one, and of course, not to talk about the fertility. That's a big issue as well. And I would also point out something about the mental health, in particular during pregnancy and what we call postpartum. Right, there is a lot of stigma around that, and in some less developed countries, basically, or people who are less educated. I believe Teresa probably with her NGO might work a lot in this, about educating its people, how you can really help these women who are going through a tough period. And most of the people around probably are saying, well, it's normal, what did you do, like you gave birth and why should you should act like this right now, and things that they don't understand. But actually that has affected, probably what Janine is saying, in the period of menopause. It's the same thing. It affects you, your job, keeping your job, because you are not feeling well. You have to do several things, and if you don't have support, great support around you, like your husband or your parents or your friends, really, I've seen cases that has been super tough. And there is not much in this. There is meditation, there is this other yoga and all this kind of stuff, kind of trying to mitigate, but still all these things are still, Russell, not being discussed that much or seen as normal things. I think this is a problem that we have. Every issue of women or sort of problem in healthcare is seen as a normal thing. And I do applaud what you are doing here in this panel, because rarely you see like these issues being pointed out, like, and people get like, oh, wow, is this really happening?
Yeah. I mean, I honestly, I didn't even know some of these things myself. I mean, I'm sitting here thinking, whoa, like 70% of people like are not being diagnosed for a certain type of cancer. Like, what is going on? Like, why is it that high? I mean, come on, like that's shocked me, which was like, it's just crazy. And you know, I mean, I'm learning so much, you know, here on the panel myself. So, but I appreciate, you know, everything that you're sharing with us, Aurelia. And you know, I think, you know, kind of going a bit off script now when you're specifically talking about, you know, support and how do you find that balance and everything like that. And when it comes to that side of things, I mean, Sorsha, I really want to speak to you on that aspect, because you know, you're doing the balancing act right now. So like, how do you find that balance and that support and that, you know, balance between everything, you know?
I'm laughing because I have had a glass of water spilled over both of us, a strawberry spat out on me, and vomit in the last few minutes. But I'm really good at listening peacefully to everything that everyone is saying, and it's amazing. But you know, I have loads of support, I really do. But nobody will take on an 8-month-old for a day so you can get work done. You know, it's very difficult. So you know, in a few months' time, it's a point in time. You know, she'll be able to be supported by a wider group. But it's I think to be a bit more solemn about what we've been laughing about, that women's healthcare is underfunded.
Yeah.
Underline statement. If we think about the pharmaceutical industry that exists, and where Viagra is $1 billion industry, you know,
that's crazy.
It's crazy. It's sobering, and fertility is so very underlooked and overprescribed. When we get to the health, the mental and emotional health side of things, that's certainly my journey and the journey of the majority of women that I know. Once you unlock all of that, and this feeds into the menopause as well. This feeds into the menopause as well. I have been on a roller coaster inward journey for the last 3 years that has transformed my physical health completely, and my focus.
Wow.
So look, the pharmaceutical side certainly has a part to play, but we need women on the boards of the pharmaceutical companies that are woman enough to stand up for women's needs and put the purse strings and the purses in the direction of women, and that's starting to be visible in the innovation space. It needs to be an awful lot faster. I work with startups. I'm working with numerous teams on sourcing where the funding is going to be and working with funds to deploy that capital over the next couple of years, and want to see this completely transformed so that when we're laughing on a panel in a couple of years, we can be honest that we are oversubscribed. The problem has been solved. Women's health is front and foremost, and our careers aren't impacted by it, because as Janine was saying, that the number of women that go on long-term sick leave, the number of women that have undiagnosed cancer. I remember this when I was a very young person going into corporate myself, of so many women of a certain age on long-term sick leave, and it was treated as a joke. It was laughable because it's like, oh, that one's off, or oh, she's on the long-term sick. But this is 20 years on, and the problem has not been solved. So everybody here is doing something about it. And Russell, what I would say to you is start talking to your friends about it. Because if you have a female partner and you don't know any of this, you are in for some trouble.
Thank you for sharing.
And your sisters and your mom and your cousins, get to know this. It's very important, and it's vital for our future, because balance has been something that's been discussed on this panel. Restoring balance of economic, health, and wealth empowerment is fundamental to how we evolve over the next few years.
No, 100% agree with you, Saoirse, and thank you again for being here, for sharing that, and look, you're here with your baby, which is amazing. So I think that's a W in itself, to be honest. It's fantastic for you to have, for you to be with us, Saoirse. So we do only have literally like 6 minutes left, so we're going to fly through some of the questions, and I want to get Mariana and Teresa in this next conversation, which is, how can policymakers and regulators better support female-led healthcare innovators? So we'll start with you, Mariana. What are your thoughts on this?
Thank you. Yeah, I mean, like always, right? People are higher up, regulators and moderators. We can't always rely on them to be solving sort of like our personal issues. So we're speaking of like putting more women on boards and this and that, and maybe that will, create some sort of impact. However, we again have to take the problem and the solutions within our own hands. And like truly, this seminar is about empowering women to do just that. And that's what I truly love about these discussions. We can't just rely on government or rely on policymakers and regulators to sort of make things better. We've got to understand and get ourselves out of that mentality that like, oh, it's because, my boss is supposed to know that. No, like they don't have time for that. They're looking at spreadsheets. The numbers need to make sense and profits need to be made, period. That's how this world runs. Like it's not going anywhere and it's not going to change. However, with technology, like you said, like how she's able to, be with her baby at the same time as she's on this panel. As more technology starts to roll out, we're going to start seeing sort of that balance and that tier come to assist us. I feel like AI, VR, all sorts of technologies like higher, faster Wi-Fi, quantum computing, even crypto and the blockchain are going to be tools that we're going to be able to use to sort of imagine your medical chart being on the blockchain. Wouldn't that be so cool? Like now your doctor is not misdiagnosing you, or if you're switching doctors, if you're in Amsterdam, but then you get treated in Brazil, like the communication is still there, and it's amazing. So technology like this is going to definitely push us forward in a better, more wellness-oriented direction. But we do need to educate ourselves. We do need to understand that all pharmaceuticals come from natural plants, like, poppy seeds that are in morphine. Hello, like it's all natural stuff being converted into pills. So once you start connecting the dots, you're like, I feel like I can take matters into my own hands because now I have the information available to me. And then you start doing your own research and your own, like even tinctures and whatnot. And nothing against pharma, but I don't think I see things the same anymore after taking that personal journey of deciding to take things matter into my own hands. And if I wasn't happy with where I was at, it's sort of like, founding my own wellness center then gave me those tools. And just having those two things come together, healthcare and wellness don't have to be at each other's throat. They can definitely fuse down the line, and technology is going to help us get there.
No, I agree. I do agree. And obviously with all the emerging technology coming out, that's not including, VR, XR, the metaverse. I mean, we can go dive down that rabbit hole. But the point is absolutely the emergent technology as a whole is going to fundamentally change our entire world, including, women's health. And, how does that positively change that? And how can that be used in the correct way and be possibly done the right way? So like how you say, Mariana, so we do. I've literally got about 4 minutes left. So Teresa, what we're going to do is we're going to fire this last question at you, and then we'll round things up. But so the last question is, what role does data play in advancing personalized healthcare for women?
Okay, I think data plays a huge part, and the more we can quantify who needs the support and what support they need, we're going to see a change, because data is everything. And that's when the companies start paying attention, the policymakers start paying attention. If we're not keeping track of data, no one's really going to listen. I think wellness is very important. I think generally our society believes that, but we need to keep track of the data and start using technology in every way we can to make sure we quantify the needs. And some great numbers have been thrown out today. Let's just continue to throw those out, because that's what catches attention. So I think that's very important.
Yeah, so we'll get Aurelia on board and start firing all those stats out.
Yes.
Well, on that note, thank you so much, Teresa, and thank you to all the panelists for joining us. And it's been an absolute pleasure having you all here. Please do follow everyone on this amazing panel. Make sure you check out their LinkedIn and go on follow and whatever else you do on LinkedIn. And honestly, it's been fantastic having each and every one of you here, including you, Sorsha, for your lovely lecture. I'm only joking. But no, it's been a pleasure having you all here. Thank you so much for joining us. And that is it from this panel. And up next, we have, I believe, the next session is The Pink Elephant in the Room by Carmen Milagros. So that'll be coming up next. So that is it from us, and I'll see you very soon. Goodbye.
Thank
Thanks
you,
so much,
everyone.
everyone.
Bye.
Bye.
Thank
Thanks,
you.
everyone.